I'm going to go ahead and get started. Good afternoon, everyone, and welcome to our second Women in Public Policy Program seminar session of the year. The Women in Public Policy Program at the Harvard Kennedy School equips leaders and change makers with rigorous evidence-based strategies to advance women and gender equity. My name is Dara Cohen, and I am a Ford Foundation Associate Professor of Public Policy here at the Harvard Kennedy School, and I will be leading the seminar series this fall semester. The series this fall is devoted to issues of gender, sex, and war, and we have an amazing slate of 12 speakers in the series who are joining us virtually from all over the globe. We are appreciative of the generous support provided by Carol Hamilton, Women's Leadership Board member, in making today's programming possible. The Carol Hamilton Gender and Conflict Fund supports a new community at the Harvard Kennedy School among scholars of gender, conflict, and wartime sexual violence. Today we have the incredible honor and privilege of welcoming Professor Anke Hoeffler, who will be presenting her research on the global prevalence and costs of gendered violence. Professor Hoeffler is Professor of Development Research at the Department of Politics and Public Administration at the University of Konstanz. Professor Hoeffler's research is in the areas of development and security. She is one of the most widely cited social scientists, and in 2019, she received an Alexander von Humboldt professorship, which is Germany's highest award for international research. At the University of Konstanz, Professor Hoeffler is in the process of establishing a research group on conflict and development research, which will provide a forum for researchers from numerous disciplines to collaborate on violence-related topics. Professor Hoeffler holds an undergraduate degree in economics from the University of Würzburg and a master's degree in economics from Birkbeck College at the University of London. She received her DPhil in economics from the University of Oxford. Before I turn the floor over to Professor Hoeffler, I just wanted to acknowledge and welcome WAP's podcast community, which has downloaded our seminars over 54,000 times. We are so pleased to have a lasting and broad-reaching impact beyond those who are able to join our virtual seminar today. The plan for today is that our speaker will speak for 30 minutes, and then we will have about 10 to 15 minutes for questions from our virtual audience. We do ask that you hold your questions until the end of the talk. And for those of you who have a question, you will have the opportunity to be unmuted to ask your question out loud. We do request that any audience questions are very brief. We're short on time. We request that they're on topic and posed in the form of a question, and of course related to our presenters' research. My colleague Katie Omberg will be managing the Q&A portion of the seminar. And with that, I will turn it over to Professor Hoeffler. Thank you again so much for joining us today.
Thank you very much, Dara. Thank you very much for the invitation and the fantastic preparation of this talk so far. So I've been asked to talk about global prevalence and cost of gendered violence. I should add straight away that this is based on joint work with James Theron at Stanford University. Now, violence kills. It kills a lot of people around the globe. So here on this graph, you see UCDP data. So this is data from Sweden. These are the sort of leading organizations on data on organized violence. So these are groups of people who kill and maim others. So since the Cold War, you can see this sort of, there's a bit of an up and a down, and then recently a sort of 2015, a peak, and fatalities rates go down. So these, you can think of these as wars. So wars between countries are very rare, wars within countries, but also community clashes. This type of violence kills a lot of people. I refer to it as collective violence in this talk. The human toll is enormous, and countries get destroyed economically. Very often bridges and communication links are targeted and buildings are bombed. So what are the causes of these wars? I've worked on this with Paul Collier, and on the consequences very much with Jim Fearon. But terrible as things are, violence isn't equal to war. There is a lot of other types of violence. So for example, this is a picture of a street in London where somebody was knifed and killed. These are pictures from a drugs raid. This is domestic violence, and this is violence against children. So maybe as a broad categorization, we've got on the left-hand side collective violence. These are the different types of war and organized violence, so community clashes, Hindus and Muslims in India, for example, or genocides in Rwanda. For example. On the right-hand side, we've got a list of interpersonal violence. So these are not groups, organized groups, but sort of individuals that harm each other. So there's homicide, physical assault, sexual assault and rape, intimate partner violence, and violence against children, elderly, the disabled. I should say straight away that I haven't got any good data on the elderly or the disabled. I'm not going to talk much about terrorism. This is clearly some form of organized violence, but it's very difficult to come up with a very good social science definition of terrorism. It's a sort of one-sided, it's subsumed mainly under one-sided violence here. One important form of violence is self-harm. And this picture, I've made this from data from the World Health Organization. The big bar shows you how many people die each year of self-harm, suicide. Yeah, so this is 800,000. And then the next bar is the interpersonal violence, yeah, the homicides. And this is just under 500,000, and then collective violence, which in the year 2016 was relatively high, if you remember the first graph. So interpersonal and collective violence together are still lower than self-harm. So I'll stop talking about self-harm now, but I do want to remind you that this is also an important type of violence. So these horizontal bars show you the different types of violence, and the blue section gives you the percentage of male victims. So with self-harm, this is the lowest bar. You can see that there's a little bit more than 60% of the self-harm victims are men. And then interpersonal violence is about 80% on this graph here, and collective violence a little bit above 70%. So basically, all this, there's a lot of blue in this graph. So violence and being a victim of violence is a very male thing, of fatal violence, I should add here. Now, homicide rates and counts. So when I refer to homicidal rates, it's always per 100,000 of the population. And counts is just counting dead bodies. I'm talking a lot about deaths because these are the easiest forms of violence to count, because you've got a body of evidence. A lot of other types of violence are very difficult to observe. So let's stick with homicides for the time being. So from the UN Office for Drugs and Crime, these are downloadable data, you can sort of see the per 100,000, which countries are the really violent ones. Well, we've got Latin America, El Salvador, Honduras, Venezuela, Jamaica, but also South Africa, and a little bit further down, DRC, Democratic Republic of the Congo. Just to give you some sort of idea of a comparison, the US in that year had about a homicide rate of 5, and Germany of under 1. So the US is 5 times as violent as Germany, you could say. Germany is quite representative of a lot of other European countries. Okay. So if you go to counts, typically the crime literature doesn't talk about counts so much, but compares by rates. But let's look at counts. So Brazil, for example, over 55,000 people a year get killed in homicides, by homicides. And as a comparison, the Syrian civil war was really very bad in 2015, that killed 45,000 people. The headlines tend to be about the wars, not about the many, many homicides that happen around the world. So when we look at female homicide rates, so this is how many of women out of 100,000 women are killed. We see that this is, I've ordered them, the 12 worst countries around the world. You can see there again, mainly in Latin America. Russian Federation makes this sad list as well. But you can see it drops off very quickly. It's sort of like the Russian Federation is then 5 and 5.5 and below. Okay, so you saw a lot of numbers. Maybe this is a little bit easier to sort of follow. So this pie chart shows you the sort of roughly 500,000 people who fall victims to homicides every year. And the yellow bit are child homicides. These are only 7%, so relatively few victims are children. And then women are about 16%. Somehow these got a bit jumbled. So the red slices are female homicides, so where women are the victims, and the bluish ones are male homicide victims. So as I sort of said with previous slides, homicide is very much a male issue. The different types of red triangles show you who is killed by their intimate partner. So this is a current or former intimate partner. And about 40% of all women worldwide who are killed are estimated to have been killed by a former or current intimate partner. There are quite a few studies on this in high-income countries. And this happens typically at around the time of breakup. And women also suffer a lot of violence and often fatal violence in pregnancy, which is sort of something I haven't quite understood from an evolutionary biology point of view. I would have thought men want their partner to survive if they're carrying their child. Men also get killed by intimate partners, but this is very few, only 5%. Men get killed much more often by people outside their households or strangers. What about age? So the blue bars are males and the red ones are females. These are rates per 100,000. So if we look at the first 2 bars to the left, these are newborns, yeah? So sadly, a lot of newborns get killed. Who kills them? Who's got access to newborns? Their parents, their mothers. And then children under 5 and children under 15 are less likely to be killed. But then the last bar of the sort of young adults, adolescents and young adults, 15 to 29-year-olds, you see a big blue bar. The big blue bar, so these are all, this is for 1 year. The big blue bar is mainly due to Latin American young men. This is a big cause of death in Latin America. And the big red bar is still an Asian issue to the left. It's baby girls being killed. You must understand, maybe I should sort of stress this with not only this graph, but all the numbers I show you. These are very difficult to put together data sets. These are publicly available data. I've downloaded them and made a graph out of this, but of course, the line between not looking after my baby girl and not giving her medical care or killing her actively is a very fine line. Neglect and active killing is a very fine line. And there's a lot of estimates in these numbers, yeah? So I think we should all focus with all the numbers that I show you on the sort of relative size. Good. So I've talked a lot about fatal violence, but what about non-fatal violence? So violence against women happens everywhere, at work, in the community, on the bus home, but most of the violence happens in the home. How do we know this? In a lot of countries, women are very hesitant to report these issues to the police. And so therefore, what I think is a much better way of assessing it is through surveys. And they're the demographic and health surveys that have an act-based questionnaire. So they ask women in private, with a private interviewer, whether the following things have happened to them. Have you been pushed, pulled, you have had your hair pulled, down to being slapped, choked, and made to do sexual things that you didn't, acts you didn't want to. And so in these sort of surveys that are available for a lot of countries, we reckon, so we as Jim Fearon and I, that about 12% of women experience some either physical or sexual or both assaults from their intimate partner during a year. And there's, as I said, there's a lot of underreporting here. Okay, so these are different prevalence rates of what we call intimate partner assault. So these bars are ordered by income. So they are the high income countries. Relatively few women in these victimization surveys say that they were assaulted. And then it goes through different regions, and to the right, the really big bars are South Asia, Middle East, North Africa, and Sub-Saharan Africa. I should stress here again that we don't have data for every country, because a lot of countries do not allow these types of surveys. This is a module of a larger survey. Okay. So, but what you should take away from here is Sub-Saharan Africa is the poorest region in the world, and the poorer countries, when you delve into the available country data, poorer countries have got higher rates of intimate partner assault. Okay. Now the table here with regions, where the first column shows you the homicide rates. You remember this table I showed you of homicide rates where the US is at about 5, yeah? So Latin America is much higher. That's the last row, 19.7. So nearly 20 people per 100,000 are killed in homicides. Okay, so the blue shaded one is non-fatal violence against women. So this is based on the survey evidence. And look, these numbers are much, much, much higher than the homicide rates. Yeah, so for example, for Sub-Saharan Africa, it's 5,800 women per 100,000 tell you that they experienced either physical or sexual or both types of violence during the last year. So a lot of you will sort of say, this is all I need to know. This is all I want to know. These are terrible prevalence rates. And I've understood that women are much more likely to be victims of non-fatal violence than men. There's a huge hidden cost, a hidden burden to society. That's all I need to know. We've gone a step further and sort of said, what are the costs of violence? So why would you want to quantify this even further? Well, it enables you to compare the fatal and non-fatal and the different non-fatal types of violence. And this is the main reason why we want to do this. But if you just want to take away this sort of messages from the prevalence rates, that's fine too. So the total cost, the total global cost of 1 year of violence around the world is the number of cases times what this one case costs, in brackets, plus the economic costs. You remember the shot down buildings and bridges I showed you. So because if there's a lot of violence in a society, then there are also additional costs or externality costs. If you have a lot of crime in an area, who wants to invest there? Nobody wants to invest there, so they're economic costs. So we add these to that. So how do we go about figuring this out? So the number of cases, I've already talked about. These are the prevalence rates I showed you. So then the unit cost is something called the value of life or value of health, value of a statistical life. I'll talk about this in the next slide. And then there are some sort of economic costs that we can figure out that occur due to civil war. Figuring out the economic cost due to crime. So if crime hadn't happened in that area, by how much would the economy have thrived is a very difficult calculation. So we focus mainly on the wars. So the unit cost, yeah, so what does a life cost? But you might find that morally, this is morally not acceptable maybe to you to sort of say, what does a life cost? Because a life is invaluable. How can you put a price on a life? So economists have come up with this concept, rather than sort of saying, what is my life or my child's life or the president's life worth? We talk about a statistical life. So think about it the following way. You are facing a 1 in a 1 million risk, and you are willing to pay $10 that you don't have to have this risk. So this is equivalent to $10 million of facing this risk at 100%, at a certain risk, as a certain risk. And we have some market information, in particular in labor markets, that provide information how people trade off life and health. Sorry, I should say life, health, and money. That's a typo. Sorry. So, for example, if you work in a risky industry on an oil rig, then you want a higher salary in order to sort of put up with this risk, to be compensated for this risk. And these are the data that we use mainly to calculate a value of a statistical life. This is about $9 million in the United States. You could also ask people, what are you willing to pay? Yeah? So you just have explicit information, not implicit information, but then people don't really know what risk they face, and because they don't really have to pay for it, it's quite obvious to you probably that people come up with much higher numbers than 9 million. Public health also has a concept of disability adjusted life years. I'm not going to talk about this any further for the moment. So maybe the takeaway for people who are not familiar with these concepts is that the value of a statistical life is a concept of how much society is prepared to avoid one death or a particular injury. Yeah? So an injury from an assault is a proportion of a death. Okay. So what do we think the global costs of violence are then? And then we add these economic costs to it too, which we are capable of doing quite well for civil wars, but not for crime so much. So look, Collective violence, the stuff that the media are full of, is only 2% here, the red slice. Homicide and assault, we sort of think is about 13%. Non-fatal child abuse, which I didn't talk about so far, is 38%, and intimate partner assault is 47%. So again, let me stress that these are only the types of violence for which we've got data that we can compare across countries. You can take issue with all the different ways of what has gone into this equation, but we just sort of wanted to carry out this exercise to sort of show you how big the relative parts of this pie chart are. Yeah? So intimate partner assault, of course, also happens from women against other women, if they're intimate partners, men against their male partners, and also by women against men. This does happen too. We don't have any data on this. This is just male on female violence. Okay, so having come up with this big sum, we can answer certain questions. So which societies have high costs of violence? These are low-income countries. And this is mainly for two reasons. One is they have a lot more collective violence, and the other one is they've got a lot more interpersonal violence. Let me stress again, low-income, poor countries have poor data. So we could be, let's not quibble about the exact numbers here, but we think that prevalence rates are much higher there. Which type of violence is most costly? It's interpersonal violence, and in particular here, the non-fatal violence against women. So this is not just a human rights issue, but it's also a development, clearly a human rights and a gender issue. It's a public health issue, and it is a development issue. And we should therefore really do a lot more interdisciplinary research to sort of get at the heart of the causes of violence and violence prevention. So we make a lot of medical progress. So polio is now eradicated in Africa, is only still endemic in Afghanistan and Pakistan, regions thereof. But there's no vaccine against violence. Do we simply have to accept violence as part of the human condition? I mean, these are very sad numbers and many, many sad stories, obviously, behind these charts and graphs I showed you so far. How could we reduce interpersonal violence? Well, we can have laws, legal reform. So, for example, Germany only made rape within marriage a criminal offense in 1996. Yeah, so it took the women's lib movement over 2 decades to get this into law, and so we need to sort of have the right laws. But very often these laws are formal laws, and they are sort of really very different to the prevailing harmful traditional practices. Just think about FGM. Every single country in Africa that has got FGM has got a law against it, but it didn't make any difference. So how do you change norms and attitudes if legal reform is only part of this? This sort of standard technology now, randomized controlled trials, very difficult. This is more about violence prevention that you can use these. Alcohol and drugs programs are probably very useful in reducing interpersonal violence, because we know that a lot of perpetrators and victims have alcohol in their bloodstream or are under the influence of drugs. We can have parenting and school programs. This is mainly against violence against children. Let's just, as the last point in this short presentation, talk about intimate partner violence. So we need a change in policing. So the US has got this in the Duluth program. DASH is the domestic violence measures that the UK police take. It's a questionnaire that goes to everybody in the household. We know that women who are killed by their partners typically have called the police in before. A lot of women are strangled, so we should in particular look for signs of strangulation. So when women sort of say they've been throttled, we should be particularly worried about these sort of things and maybe make this a specific criminal offence. This is a discussion at the moment in the United Kingdom. Then there's a lot of talk about economic and social empowerment. So if women go out to work, you know, how does this change domestic violence? Very mixed evidence here, unfortunately. Changing norms through, for example, infotainment, so soap operas is quite promising in places, but I think one of the most interesting things that has come out of US research is teen education. You have to educate teenage boys and girls when they're 14, 15, before they start on their first relationships, what a respectful relationship is, and how to sort of settle disputes and how to have verbal arguments, because we know that in particular teenagers, 15 to 19, have very high rates of intimate partner violence, also female on male, because teenagers have got low locus of self-control, substance abuse can be very high. Girls in that age are very often not that much weaker physically. So there are probably a number of different reasons why rates of violence are particularly high in these couples. And once these patterns are established and you stay with this partner, this gets worse for women typically. This is very bad news. Or if you've learned these patterns of behavior, you're very likely to sort of transfer these to the next relationship. Let me stop here and take some questions for you. I've handed over the presentation to the organizers, so you can have a look at further readings, or let me just maybe have this as the last slide, have further readings and additional slides in there. Thank you very much for your attention.
Awesome. Thank you so much for your presentation, Professor. I'd like to now open it up to questions. And if you have a question that you would like to ask out loud, please go to the participants tab in your bottom menu, and there should be an option there to raise hand. That's how I'll know you want to ask a question, and then I can unmute you so you can ask your question. You can also ask it in the chat if for some reason that doesn't work. And just based in the interest of time, Professor Hoeffler, if this works for you, I'll maybe take 3 questions all at once and then you can answer them. Does that work? Fantastic. Yes. Great. So I see the first hand is raised. I see Lisa has raised her hand. Lisa, I'm unmuting you now.
Hi there. Thank you so much for this wonderful presentation. I just have a question. US data doesn't appear to be all that good too, and we obviously have a high prevalence of violence in America, and we estimate it to cost $3 trillion. So when you go back to your slide showing the numbers, $3 trillion of that, depending on, I guess, how it's measured in costs, whether that's mental health, productivity, GDP, all of that. So I was wondering if you might comment on that and just lack of data and lack of systems to track data writ large. And then if you had any comment on constitutional amendments around equality and if they've had any impact, because in America we've had 2 cases go to the Supreme Court, both around gender violence, and our Supreme Court justices said we can't decide this. The victims don't get any justice. But we can't decide this due to a lack of a gender equality clause in our Constitution. Thank you.
Great, thank you so much, Lisa. And I see Precious has her hand raised. Precious, I'm going to unmute you now.
I think I need to unmute myself. Can you hear me now?
Yes, thank you.
Okay, thank you. Thank you very much for a very instructive, very, very important presentation. This is a topic that is very important, and I know I've received quite a few messages from my colleagues wanting to know why I'm joining from South Africa. And as you have noted, South Africa is one of the countries that have a high prevalence of what we call gender-based violence. South Africa is really, really high, you know, in terms of prevalence. And my question is, do you find that countries that have a very strong patriarchal systems tend to have high, you know, high rates of gender-based violence? And secondly, societies that have gone through, you know, one form or another of violence, as in wars, or, you know, in South Africa, we went through periods of, very long periods of apartheid and brutality. Does that play a role in, you know, then perpetuating violence in amongst the weaker members of society, such as women and children? Thank you.
Wonderful. Thank you so much for that question. And I see that there is a question that showed up earlier in the chat from, let's see, let me go find it, from Nishith. It is, is there a similar table about underreporting across regions? And Nishith, if you want to expand upon that a little bit more, raise your hand and we can unmute you if you have anything you want to add to clarify around that question, because I think it was in reference to a slide that we've lost track of. Okay, I'm not seeing Nishith raising a hand. So Dr. Hoeffler, I'll turn it back over to you.
Yes, thank you very much. So the question of similar underreporting across countries, we can compare the official police statistics that are reported to the UN with victimization reports. And for a sufficiently large number of countries, we've got an overlap there. And yes, it doesn't seem to be the case that this is the same rate of under or over reporting. So we therefore try and focus on the victimization reports. But even, I mean, I said crime statistics are reasonably good for homicide, but when you delve into the country specifics, very often you just sort of think, okay, there's a lot of underreporting here. Or dressing up homicide as suicide or as accidents. So we had pressures from South Africa. There's a very interesting research team in South Africa, Richard Matsopoulos at the University of Cape Town, and he's done a mortuary study. So he's gone through to mortuaries and sort of really looked at causes of death. And he finds more dead bodies than are officially recorded in South Africa, and he finds that certain deaths are really misclassified. But we only have this for South Africa. We don't have this for any other African country, for example, that I know of. There are efforts in Brazil by the Igarapé Institute to provide very good homicide count data. Okay, so far to the statistics. Precious also raised a very important issue of what, so she didn't say that, she was too polite, but basically my presentation says there's suicide, there's interpersonal violence, collective violence, yeah? And these are these different silos in which we also research differently. But clearly there's a big connection. And there's so little research on this. colleagues of mine have interviewed Angolan men 15 years after the Angolan Civil War. And those who, it's very difficult what you can ask people in an interview, but those who said they witnessed sexual violence during the war, not that they took part, but they witnessed it, their partners suffer more violence 15 years after the war. So there is clearly a I mean, as Precious suggests, you know, it's an obvious connection that if a society is brutalized through apartheid, through war, through high homicide rates in Mexico, femicides go up, yeah? But it's not terribly well understood, and also, and very little research done on it, because then we could sort of put resources. Because when you sort of say it's obvious that there's a connection, we need to understand this better in order to sort of put the appropriate amount of resources into post-conflict or post-very violent countries to reduce violence. Okay. So anybody listening there who would like to do this research, I think is really important. It's also the domestic violence makes women feel more suicidal. Yeah, we know this from the surveys. This is, again, very important to work with psychologists on these overlaps. Then, Lisa, I agree the US data are poor. So, for example, when you look at deaths in police custody or deaths with police arrests, official numbers are very different to the numbers that are collected by various other agencies. So even high-income countries can have very bad data. Totally agree. What is in my 9.5 trillion sum of money? Well, so there are a lot of different costs that are glossed over. So they're tangible costs. So of course, medical costs, they are justice costs, the cost of correction, putting people into prison and rehabilitation. You have lost income, your family needs to care for you, and so on. It's sort of concentric. There are these ecological models of sort of like cost to yourself, to your family, to your community, society, and global. Because if you've got a very unstable area like the Sahel zone, you try and cross it and get on a boat in Libya and try and reach Europe. Yeah. So some of these costs, I'll refer you to the book chapter I've done with Jim Piron. Some of these costs are easier to estimate than others. And here we've focused on these intangible costs. You know, what would a society be willing to pay not to have this type of violence, and by how much were societies damaged with a war? So it's a sort of what if, it's a counterfactual. If countries hadn't had that war, how much better would they have been off? Thank you.
Great. Thank you so much again for that really fascinating and disturbing talk, Professor Hoeffler. And thank you to our audience for attending our session today.